Thank you for joining us today. My name is Colette Balaam, CEO of Hive Health US, a Kin Carta healthcare consulting agency focusing on healthcare experience. I'm joining you from New York today, and I'm also joined by my two esteemed colleagues, Karl Hampson, Director of AI, who's joining us from London. He spent his entire career at the intersection of technology and every kind of data you can think of. And when he's not talking about that, you might find him on a mountain in Europe, writing puns or both. We're also joined by our guest today, Steve Prewitt, Chief Analytics Officer at Healthfirst. Steve runs a team of analysts, data scientists, and data engineers dedicated to improving people's engagement with data. And Steve has worked in multiple segments of the healthcare industry, including pharma, CRO, home health, and insurance. Steve, Karl, thanks for joining us today. Healthfirst is a provider-sponsored healthcare insurance agency that serves more than 1.2 million members in New York. They are also a client of Kin Carta. Today's webinar is sponsored by the digital transformation firm Kin Carta, which is our global connected of 1,500 technologists, strategists, and creatives across 4 continents. And we combine the pillars of strategy, innovation, and communication to serve our clients. We've been recently recognized by Forrester as a digital experience agency ranking highly in client co-innovation. Just want to make a note here that before we get started, we are going to be running this webinar from multiple locations across the Kin Carta network, and we have a lot of topics to cover. So I will be interrupting Steve and Karl if any answers run on. Some of the answers we'll cover you may have heard about already. We've done that intentionally because we'd also like to share some of our own specific views around these topics and provide some valuable key takeaways. So why don't we start with the topic of today's conversation, which is data. Mark Bertolini, CEO of Aetna, recently did an interview and summed up the U.S. healthcare system quite accurately. As he said, no matter what people think about the healthcare system today, everybody hates it. He goes on to point out that the #1 item in household budgets is healthcare, and yet it remains one of the most horrible experiences that we have to deal with. And so it very much brings to light the should we and how do we fix it dilemma. Today we're going to explore data and most importantly what we're all interested in, which is tangible patient and business outcomes. We'll look at some opportunities to improve care and be more patient-centric by providing data in a useful way. Before we do that though, we need to understand what we have to work with. So let's first take a look at where the data is within the healthcare system in the US, who owns it, and what the regulations broadly say so we understand what might be possible. Steve, can you tell us how you see the data landscape for healthcare in the U.S.?
Sure, and thank you, and hello, Internet. So I guess I'll just start by observing something that's not incredibly penetrating, that the U.S. healthcare system is really fragmented. It's fragmented, horizontally and vertically, and the data systems that support those various fragments are disparate, and the incentives that govern the sharing of that data are often misaligned, and the kind of government regulation or regulatory environment is set not expressly against sharing data, but against sharing data for generic purposes. It all needs to be for very specific purposes, such as coordinated care, right, or delivering better outcomes. So in that environment, you have this desire to improve the patient experience, but a lot of that activity is data dependent. So if we want to increase transparency, decrease friction, better match patients with services, a lot of that would be greatly enhanced with acquisition of more and more varied data. So for conventional and structured data forms, it turns out to be a tiny minority of that opportunity. And as we see in other industries, I'm sure I'll talk more about this later, the explosion of unconventional or unstructured or sensory level data and our ability to make sense of that data has greatly increased. And so I think there's a lot of ways in which healthcare lags other industries structurally because we're sensitive to how healthcare data is shared and used. And then there are other ways in which it lags from a regulatory perspective because there are direct and meaningful barriers to how data in the healthcare space can be shared and what that data shared can be used for. I'll just pause and hand it over to Karl.
Thanks, Steve. This is Karl. Hi, everyone. I'm joined from London today. Steve, I know only too well the pain of trying to create digital products which have got significant data dependencies and integration points. It can provide a real headwind in making progress. So I find it really interesting to see tech innovators such as Redox gaining traction with their single cloud integration platform for patient data exchange and interoperability. Is this kind of approach the answer to the challenges of bringing data into the patient experience in healthcare today?
Yeah, I mean, I think there's a lot of innovation going on in this space. I think I guess I would split up the problem into a couple of buckets, right? For structured data that is well understood, transaction data, for instance, standards predominate, and where standards are able to be articulated, then you see communities come together around those things and innovation, on those platforms, and you'll see things like FHIR, HL7 would be opportunities for that. There are also other, formats for non-structured data to start being gathered. The Apple Health app would be one obvious opportunity. Whereas unstructured information about people's health activity becomes more available, then the integration opportunities become greater. And so, Redox being one example, but there are a lot of other examples where firms are entering the market trying to say that they are aggregating health information for a way that can, empower patients and also enable healthcare service providers to provide better health. Honestly, I don't know if people will tolerate, you take this to the logical conclusion, this kind of quote unquote blockchain of health, some master record that includes genetic information and, prior utilization history and lifestyle and demographic features that as a healthcare analytics guy, I would love to have. I don't know if the privacy environment, the regulatory environment would tolerate that kind of, one solution to rule them all. That said, the allure of that idea is powerful for people who want to use everything they know about people to help improve their health. The other thing I think is an impediment to this kind of single integrated view of healthcare data are large established healthcare technology interests that propagate a kind of walled garden mindset or ecosystem associated with products that they build. So as innovators come in and try and break into those walled gardens and get the data out, there's kind of both sides of the equation are trying to innovate faster than the other side, adding to the confusion. But I think investments in creating these more universal health records that are in control of patients and shareable with providers at their discretion, I think it is a powerful trend. Okay,
so that said, if you think of the data that's near, the data that's easily available, readily available, where are the opportunities to do better with this data you've already got? Can you share any examples of the data that you think fits in this category, and any successes where you yourself have achieved some rapid time to value from this data?
Yeah, so it's easy to get into an event like this and talk about, all the data we don't have and all the friction associated with getting data and using that data to improve our members' experience. But at the same time, we have a list as long as your arm of real use cases in the real world that are making a difference, with our members. So investing even with structured data sources and sprinkling on information about interactions we have with our members, either in the community or through things, outbound services that we provide, or even when they call us and talk, we can use that information to do all kinds of helpful things, whether improving their access to care, predicting and intervening when we think members might be dissatisfied with their experience, helping members close their care gaps, decreasing hospitalization activity and all kinds of preventable activities going on in there, even doing things like understanding when a particular event might be the trajectory of care might take the member in a dangerous direction, so we can interact with their care team. And then outside of directly of the member experience, there's all kinds of other use cases that we're pursuing. The easiest of which to talk about it, things like preventing fraud in the system, where bad actors become increasingly more sophisticated, about how they bill for health services that are fraudulent in one way or another. So we are currently using, even as messy and disjointed as the data often is, we're still using it to drive real measurable outcomes in the world, and having some success with it.
Okay, and that's great to hear.
I think. Oh, sorry. Go ahead.
No, go ahead, Colette.
No, I was going to say, if we just stop there for a moment, we just touched upon the idea of experience, and the idea of experience being above and beyond the clinical interaction with a physician and their patient. Why don't we focus in a little bit more on what that patient journey looks like, or member journey, customer journey? Certainly we want to acknowledge that as a human experience, it's influenced by many factors within the healthcare ecosystem, of which many are suffering from friction. Steve, like you mentioned, clinic waiting times, claim coverage, understanding your own prescriptions in the pharmacy, and very simply, oftentimes, access to care itself. Everyone we know wants a better experience. There was a recent study done among healthcare executives surveyed, and 53% labeled patient experience as their top challenge they plan to address over the next 3 years, and it actually outranks cybersecurity, finding qualified staff, and compliance. A key theme is using that data to reducing friction. Obviously, like we started with, we don't want that horrible experience. But before we explore a little bit more about ways to fix it, can we look at some of the incentives across the various parties as to why we want to actually fix it? And what are some of those incentives, Steve?
Sure. So, man, there's a lot of stuff in here. So I'll be as succinct as I can. Unfortunately, the structure of healthcare has a lot more in common with the structure of airlines than it does with the structure of a customer-friendly business model. I'll say a little bit more about that. So maximizing throughput on high fixed cost items. So doctors are expensive, MRI machines are expensive, hospitals and operating rooms are expensive, often means that the patient is treated more like a product than they are like a customer. So moving people through an operating room can really change the financial picture for a hospital, for instance. And so optimizing an individual person's experience of their time in that operating room is a secondary concern. I'm talking economic structure here, right? I believe that both doctors and healthcare professionals care a lot about members' experience, but that often the economics often get in the way. When you double that with the fact that the patients are the consumer, right? They're having a doctor visit, they're getting a prescription, they're often not the payer, and so the natural alignment that happens when a person who's seeking a service is handing over money for that service is a little disjointed. So this maximizing throughput and the patient as the consumer but not the payer, like double disjoints the opportunity for there to be an excellent member experience. So, but some of those underlying structures are changing, right? So as health plans push more of the economic burden onto members and patients, you see more of a buyer's mentality. You see healthcare consumers acting like healthcare buyers. They want to know the quality of the service they're likely to receive. They want to know the cost of that service before they actually have to pay the bill. And you can see this especially in leading areas of healthcare, where like a subscription-based primary care market, for instance, right? Where generally higher income individuals are subscribing to the ability to walk into any one of a set of doctors' offices and get an appointment in 10 minutes and kind of have a wonderful experience with that kind of integrated data. So I think part of the issue is simply structural, and as patients become buyers, not just consumers, I think you'll see this kind of rapid realignment to treat patients like customers.
Steve, let me just turn the theme back a little bit more technical. Some years ago, I worked on a groundbreaking system which was finding patterns and outcomes from patient safety events, which had effectively occurred during routine care. Each incident was captured by patients or medical staff on a paper form. There's loads of fields to fill in. But the idea was that it'd be possible to spot emerging patient experience issues and trends across the entire healthcare system in the UK. So the first version of this could do stats on the structured data. I've heard you make reference to structured and unstructured data so far on the webinar. The structured fields were very well handled, but it totally ignored all the free text. and that obviously contains huge amounts of richness. And we know that roughly 8% of the world's data today is unstructured. So, by way of example, imagine that there's a lot of people falling over all of a sudden in different hospitals, an incident type of a slip or a fall, and that would emerge as a trend. But to actually understand what was going on, what the root cause was, you had to read all of this text. So what we did was, by applying unsupervised machine learning on the free text and combining the patterns in the textual responses with the structured fields, we were able to pull that information apart, the dimensions of that, and actually get to the root cause of these incidents. So this was ultimately a retrospective approach in terms of improving patient experience care. But my point is this: it was there was information there that wasn't being used, it wasn't being exploited, and it was by understanding how emerging technology could get more out of that this approach was transformative. So it's kind of back to this idea of, you've already got the data, you just need to think about how you can derive value from it. Do you think those sorts of opportunities are there still today for improving the patient journey and experience?
Yeah, well, I mean, I keep showing up to work, so I hope they are. I think that we're really only just scratching the surface on what unstructured data can bring to, here we're talking about patient experience, but the entire healthcare ecosystem can be positively influenced. So everything from, kind of real-time analytics when a member interacts with our mobile app or our portal, or calls member services or talks to a care manager. Also, there are always things, we're always trying to make unstructured things structured and trying to better understand the unstructured things that we have, so that we can drive more insights and hopefully reduce friction and improve patient experience. So, I think that the technologies to do that kind of thing are much more widespread and much more economical than they have been in the past. And so a huge kind of pattern of investment in my world is investing in these kind of flexible, often cloud-based tools and patterns that can quickly marry structured and unstructured data and pursue these kinds of kind of patient experience improving outcomes.
Steve, you talked a little bit there about how you use the insights. What about the quality of the content for communication? So as opposed to the raw analytical data, many patient journey touch points obviously involve having access to relevant information, which often may come from a brand or a medical resource website today. How at an enterprise level do you balance the scales between data used to obtain insights to ultimately improve patient experience with the content required to optimize these outcomes?
Yeah, I mean, I think I'll just speak for my lane, right? So, leading an analytics function, we're primarily interested in using data from whatever place we can find it to incrementally improve how our members experience their care and ultimately their health outcomes. There are certainly improvements to be made in helping members understand, their benefits, the quality of care that they're likely to receive, their wellness, and we're I'll just say supportive of those efforts, but those aren't efforts that I directly lead. I would be out over my ski tips to add much more to the discussion than that.
Thank you. We've talked a lot about patient data. Karl, I know you wanted to talk a little bit about emerging technologies, so why don't we move into that section so that we can cover a little bit of that content?
Sure. Thanks, Colette. So as an engineer, I've always been deeply interested in emerging technology, both as a consumer and professionally. I'm always the guy that goes out and buys the new thing before everybody else. But I love evangelizing about the possibilities of technology and that it can enable. In healthcare, wearables seems to have found its perfect application, and I'm really excited by that. There's a story recently about some guy that discovered an underlying heart rhythm issue from alerts from his Apple Watch 4, and that proved inaccurate when it was checked out. These sorts of stories are starting to come through. What's interesting, though, is the data that these devices are creating. So Steve, interested in your thoughts on these kinds of advances, and more specifically, the value and the potential of this data that's actually being collected by us and is within our governance. What are your thoughts?
I mean, I think we're talking about wearables, sensor data, kind of ambient video, stuff like that. I think these are more unconventional data sources, so they're of a type, right? So just like it used to be groundbreaking to be able to take the audio recording of a sales rep call and transcribe that to text. Now that's taken as given, and now we have yet more sources of seemingly useless but actually quite interesting data. It wasn't that long ago when people were putting sensors on air conditioners in warehouses and using that sensor data to predict which units needed maintenance before they actually failed. And I think this is kind of the same thing, right? It's applied to health. So a lot of the monitoring devices, personified in the Apple Watch, but also lots of other glaucoma sensing contact lenses and things like that, I think are really just starting to come out. That they'll start out probably being use case specific. The devices will be sufficiently expensive that people will get them for a particular reason. But as the cost of that technology drops, you'll see this in the pedometer, right? Fitbit is like a feature masquerading as a product, right? I mean, the idea of categorizing and counting steps and pedometry data is now just a feature of everybody's smartphone. And so I think that that race where new data sources are developed and then new insights are derived from those is a race that's going to continue well into the future, and we're probably just starting, not finishing that race.
Okay, I mean, that's interesting. So why don't we just go a bit further then in terms of how it might play out? So, as more sensors are developed for wearables, it seems that the possibilities for preventative care are pretty much endless. I'm thinking about it, we can store these kind of personal vitals and lifestyle factors. Then maybe at some point there's going to be increasing pressure for us to actually increase our transparency with providers with this data. So where's the tipping point for you on that, do you think? And is there a creepy line?
Yeah, this is where healthcare is different, right? I mean, if somebody was a really terrible driver in the past and they had 3 or 4 or 5 accidents and they came and asked you for car insurance, you would obviously take into account the fact that they're a demonstrably bad driver. But if someone's had 3 or 4 heart attacks and they come to sign up for health insurance, it's uncool to be like, oh, well, I'm sorry, we can't cover you. It's actually unlawful in the U.S. Because that seems morally wrong, right? But I do think we can look at other industries for some answers in that. Public surveillance is another one of those things. It's a dual-use technology, just like genetic data, where you can increase traffic flow, you can decrease pedestrian deaths, you can improve the kind of use and infrastructure on city streets by just putting really cheap cameras everywhere and watching everybody. Of course, you can use that technology for a bunch of other really bad things, and I think health data is the same place. So in this kind of world where there's an explosion in devices that can record data and the ability to process and understand that data, I think we have a growing understanding in the public of what free services, Google, Facebook, etc. The price of using those free services is the data that you generate and the things that they can do with it. As people become more aware of that, they become much less, keen, right, to share data with no obvious payback. So I think if we can keep it patient-centric, if we can keep it, self-directed, I think that we'll stay on the right side of the creepy line. But this kind of global acquisition of data for health, I think is I don't think it'll be tolerated. Let me just say that.
Okay. Colette, have I got time for one more question on emerging tech? I just wanted.
I think so. Yeah, I think so.
Okay, I just wanted to ask Steve, so just taking this further, what do you think then the forcing functions are for kind of wide adoption of this idea? Is it just, as these devices become, mass market, that, there are more people there? Or is it the fact that people are seeing some value or some payback in actually sharing their data? Where do you think that's going to go to turn this into, mass adoption? Everybody just lives their lives in this way by having, sensors.
I mean, so I think it's very similar to what you see in other areas of life, right? So the reason people put pictures on Facebook is not because they want to improve, the data trove of Facebook. They do it because, they want their grandma to see what they did this weekend. And so I think the reason people wear wearables that can track health data is because it provides some benefit to them, right? They like tracking their steps. They like they like competing with friends. Or their health plan gives them some kind of benefit, right? To, like, already you can sign attestations that say, I don't smoke, and they give you a bump. You can imagine a future where they say, well, if you have an Apple Watch and you let us track your steps, like, we'll give you a discount. Like, that's that I think is not too far off. And then, people who aggregate that kind of data can use it for more population healthy type purposes.
Yeah, I agree. Really interesting. Thank you. Colette, our final theme, you're going to take us through population health. What's happening here with efforts to improve our overall health using data?
Yeah, I think, why don't we start, because we touched upon it in Steve's last answer, with community health. We know that social factors are considered impactful, since only about 20% of health outcomes are determined by clinical care. The remaining 80% is determined by non-clinical factors, most of which are influenced by geography and socioeconomic conditions. When we think about addressing these needs, certainly in the hospital and emergency care setting, we know that we need to look at these components, because each one of these challenges presents its own unique elements in terms of how to define the problem, collect and share data, form community partnerships. Steve, can you share with us where you see the greatest opportunity to help bridge this gap and affect care in the communities that we're serving?
Yeah, it's a broad area and a particularly poignant area of interest for Healthfirst. We serve a population as diverse as New York City, and so we think a lot about the non-health factors that are inherent in our city that affect our members' health. There are a lot of things that could be done to make this more impactful, and some of those are directly data related. One thing is a standard approach to tracking people who are struggling with non-health factors that might influence their health. So right now, there's no incentive when a patient has an interaction with a doctor. There's no incentive for him or her to ask the patient, in the last 7 days, have you or anybody in your household gone hungry? Or in the last month, have you had to prioritize which bills to pay or which pills to take? And then to report that back to us in some structured way that would enable us to intervene and connect them with non-health services. So a standard approach to coding, better and more descriptive coding, and incentives for healthcare professionals to screen for those factors are certainly three structural items that would really help. Then I think non-health factors, if we thought about non-health factors the same way we thought about health factors, then we would think about things like building a network of social determinant related services that could be deployed, based on barriers that our members are facing, and then we would gather utilization information, right? So if we refer a member who has food insecurity issues to a SNAP facility for food stamps, and we would like to know, did they go? If they went, did they get the stamps? If they got the stamps, do they know how to use them? And then if they know how to use them, are they eating healthier and better able to engage with their health? So none of those things, or I should say all of those steps in that process, are fraught with observation challenges. But I think if we want to address the non-health features associated with healthcare, those are some of the things we're going to have to do.
Wonderful, thank you. And that actually brings us to our close for today. We obviously would love to explore these topics further and look forward to reconvening. I want to say thank you to Karl and Steve for joining us, and thank you to the audience who joined us today. This webinar will be available on demand, and the information will be provided to you in a follow-up post this call. So thank you again, and have a good afternoon.